A thumb spica is used to protect and support the joints of the thumb. This presentation is going to focus on an injury to the ulnar collateral ligament, as it is the most commonly injured ligament of the thumb. Injury to this ligament is often referred to as a gamekeeper's thumb or a skier's thumb due to the high injury rate in these activities. However, injury to the UCL of the thumb is also seen in collision sports, such as rugby, where there are torsional forces acting on the thumb, or in injury mechanisms that involve falling on an outstretched hand, as this motion can also stress the UCL of the thumb. Regardless of the specific mechanism, an injury to the UCL of the thumb results from forced hyperextension and abduction of the metacarpal phalangeal joint. For this tape job, you will need pre-tape spray and zinc oxide tape. Be sure to check the athlete and the area for any contraindications of tape application, assess pulse, motor response, and sensation before application, and spray the area for better adhesion. Apply the first anchor to the wrist distal to the bulk of the forearm musculature. Have the athlete make a fist and press into your hip to avoid chasing hands and also to better activate the wrist musculature so as not to apply the anchors too tight. Place a second anchor around the thumb with half the width of a standard size tape roll just distal to the interphalangeal joint, ensuring not to cover the nail. Place the athlete's hand in a position that resembles holding a cup. Apply 2 to 3 strips of half-width tape along the palmar surface running from the proximal anchor to the distal anchor, covering the thenar eminence. These strips are meant to act like a splint on the palmar surface of the hand. Note that these strips may be altered in their position to the lateral or dorsal surface of the thumb to meet the demands of the sport and better support an injury. The most important thing to note with this tape job is that the thumb has its own arterial blood supply. When applying the anchors, the therapist must be careful not to apply too much tension. Cutting off the vessels in this area could cause pain, diminished sensation, and lead to possible tissue necrosis if left on for too long. Prepare 2 to 3 long strips of half-width tape. Apply these long strips in a teardrop manner such that the strips are encircling the thumb. The first strip should begin on the palmar surface, bisect the webbing between the thumb and the index finger, then end on the dorsal side of the hand. Additional strips cover the same pathway and overlap the previous strip by half. These strips are meant to stabilize the metacarpal phalangeal joint against extension and abduction. The goal with this particular tape job is to decrease the amount of bulk on the hand while still providing stability and allowing for necessary function. In order to have less bulk on the hand, the anchor was placed around the wrist. The wrist anchor must not be too tight or else it will limit flexion and extension of the wrist and impair the athlete's performance. Reapply the proximal and distal anchors in the same manner as the initial anchors. Recheck pulse, motor ability, and sensation, as well as ensuring all desired ranges are limited. Have the athlete complete sport-specific functional testing before returning to play.